Hi, my name is Samantha Drafke. My ID number is N01896656. For question one, why do I want to become an occupational therapist and how did I first become aware of OT? This was when I was 12 years old. My uncle suffered from a massive stroke on his brainstem. He was completely unable to do any tasks for himself and was not able to speak at all. I saw how this affected my cousins who were my age and my aunt. They had to do everything for him. After he became stable, he was sent to the Rehabilitation Center of Chicago. And after his stay there, he was able to feed himself with assist devices, use a remote and computer, and had recovered most of his speech back. I saw the relief this gave not only him, but my cousins and my aunt as well. And this also gave him a lot of his independence back that he thought he lost forever. This was my first experience with occupational therapy, and I was really impressed with it. At the time, I really only knew about physical therapy because I had a lot of injuries myself and was in a lot of therapy. But this was when I knew I wanted to become an occupational therapist. I knew during my shadowing hours that I wanted to be an occupational therapist. I did both OT and PT hours, but the OT hours really impressed me. I did my shadowing hours at RIC and I saw a lot of different types of therapies and a lot of different types of patients. Um, and I just thought it was really rewarding teaching someone how to feed themselves or brush their teeth or doing other tasks that they all took for granted before their injury or illness. For question two, how is occupational therapy different from physical therapy? In my view, OT deals more with exercises to get back functions of daily living, like being able to eat, brush one's teeth, shower, and other tasks most people take for granted. I have seen in clinical settings OT specializing in hands, including fine motor skills like gripping, pinching, and writing. I observed a small group therapy section, and their whole exercise was just playing a card game. Point of this game was to be able to pick up cards and grip them and hold them. Um, like I said earlier, I have a lot of personal experience with physical therapy. I have come to view it more as like gross movement rehab, like getting back into shape after an injury or working with large muscle groups. At RIC, I saw a lot of the PTs working with their patients trying to learn how to walk again. For question three, why do I want to get a doctorate degree when the current entry level requires a master's? I believe just like with physical therapy, OTs will be required to have a doctorate in the future, so getting a doctorate now will save me time and money and will benefit me greatly in the future. And I know this extra education will give me more knowledge to be the best therapist I can be. Where do I see myself 10 years from now? And how do I see this degree helping me? I see myself working in a hospital setting, sort of like RIC. I really enjoyed my time there, and my two favorite units were the spinal cord and brain injury trauma units, and I really would like to work with patients like that in the future. Those fields have always fascinated me. I also have a minor in psychology, and this is where the two fields meet the best. An OTD degree from NSU will allow me to get my dream job working in an inpatient setting. This degree will give me a step up in the competition in this very competitive field and give me great experience to be used with my future patients. For question five, I did some research on this program, and I know it is mostly online with 4 days if in class every month. This will be a great program for me because I'm from Chicago and I'll have to move down to Tampa just because it will be more convenient for those in-class times. And it would be really important for me to be able to work and have an income. So being able to have and working online and having more time to be able to work is just really important. I also have a lot of experience with online classes. During my undergraduate, I took multiple online classes and did really well in them. I already know that I have the motivation and accountability to study and learn online. I'm also well adapted with technology and have used Blackboard in many, many times. I know how to navigate through the system and I have a lot of confidence using it. For question six, cultural diversity is really important, just obviously in general, but really also important in the medical field. During my time at RIC, during my reservation hours, there was many different types of patients from around the world. There were two patients from the Middle East, and there was one patient from Poland, and all three of those patients had their family present with them. Being culturally diverse is just important during these times and in this setting, but like occupational therapists will be in a lot of close contact with many different types of people, and it is important to understand their culture, not only not to offend them, but also to understand their motivations and to be able to relate to them better. People have many reasons why they want to work hard to get back to work or just to be able to feed themselves again, and learning their cultural background, I think, is a really big reason why many people have different motivations. So learning those cultures is really important. Therapists need to be trustworthy and open because people are coming to them at their most vulnerable states. Having a therapist that is closed-minded to other cultures will make a patient feel disrespected, along with other emotions that can hinder their progress. In scenario one, from an ethical standpoint, not looking at this from a tattletale perspective, I would discuss with the professor my concerns with those students who had an exam of the copy ahead of time. I mean, there's a really good chance the professor didn't know about it. In addition, I would address my concerns with my lack of understanding of the material so I can better be prepared and have knowledge for future exams. If I fail an exam, it's not because I didn't study or wasn't prepared, it's because I really just didn't understand the material. For scenario two, I would say to my patient, I am not very familiar with your surgeon personally. However, if you would like another opinion with a hand surgeon, I would recommend the following providers and give them around 3 other choices. This will allow me to provide better care for my patient without disrespecting another professional. Question 9, my strengths include my passion for learning, being empathetic, and my caring nature. I have always loved helping people and I love volunteering. I volunteered all throughout high school and all throughout college. I think it's really rewarding, and I know occupational therapy is going to be just as rewarding. I'm very open and easy to approach. A lot of my friends come to me when they have problems just because I'm a really great listener and I give good advice. I also have really good time management skills that I learned from being in many sports. I was a gymnast for many years, and I went to practice 5 days a week, 5 hours a day, so I always had to make sure I fit in time for homework, and I usually did that early on so I had time after practice just to relax a little bit. An area I need to work on is overcoming my shyness. I've been shy my whole life, and I get really nervous public speaking. For a long time, I would get nervous just talking to unfamiliar people too. But I always knew I wanted to go into a field where I would have to talk to new people constantly. So I put myself in a lot of situations that were out of my comfort zone to get over this. I got a job as a hostess when I was 16, then became a server at 18, and those 2 jobs really helped me learn how to be out in the public and be more social and learn how to start conversations with people. I also went to college in a different state where I knew absolutely nobody, and this really helped me and it really pushed me to become more outgoing. I still get a little bit nervous around people, especially speaking in front of a crowd, but if I keep pushing myself and putting myself in social situations, I know I'll be beneficial. I was a little bit nervous to do this video too, but I know it's going to help me too. For question 10, why should you take me? I'm a very hard worker with excellent organizational skills and time management skills. Like I said earlier, I was in a lot of sports and I always did my homework and I always studied and I always got good grades. I work really well with others and I'm a great team player. I was the captain of my tennis team during high school. And I'm really good when it comes to school assignments, group assignments, and work tasks. I get along with a lot of different types of people and I'm really easygoing. I'm also really passionate about this field since I have personal experience with it with my uncle and my family members who were personally affected. I know this will motivate me to be a great therapist, and I know I'll get involved with the family lives because I just think that's a really big part of therapy and a really big motivator for the patients to work harder. Overall, I have a very caring personality and a really big desire to help people, and I know I'll make a great occupational therapist.